Okay. First of all, we're 7:30 sharp. I'd like to thank everybody that's attending to this first live session of Encos Brazil. It's a pleasure having you all here. Hope you enjoy. It's an interesting topic that I want to cover today. It's how system approach can change in the way the world's dealing with COVID-19 pandemic. We have here with us Tom and Claudia. They're gonna introduce themselves when it's time. But first of all, I'd like to invite you all to follow Inco's Brazilian chapter and Inco's International on the social medias. We're gonna let the links here in the description of this video, and also on the end of the video we're gonna let a screen with our addresses. But you can follow us on Instagram, LinkedIn, and of course visit the Inco's International website. It's incos.org/Brazil. And why I'm inviting you guys to join Incos on the social, to follow Incos on the social media is because there's much more to come in terms of webinars, podcasts, and interesting content on this discipline. We know that you're here because it's maybe your first contact or you are already specialist on systems engineering, but I'm pretty sure that following Incos is gonna increase definitely your interest on this topic. And it's of course an opportunity for you guys to join us on the effort of spreading systems engineering, not just in Brazil, but all around the world. So you can contribute as well. You can be part of a webinar podcast. So that's invitation at a large. You can just follow us or can join us on this kind of effort. Okay. So I'm gonna give space and screen for our invitees.
Hello.
Hello. Good evening.
So it's my first live, at least. I think that Claudia as well. I don't know about Tom and Fabio.
Been live a few times.
Oh, okay.
That's a challenge, right? Like a English spoken live about such a interesting topic for being the first time. Anyway, let's start. You are the host.
Okay. What a hard job, you know. But first of all, I'd like to introduce myself. My name is João Prado. I'm the president-elect of Brazilian chapter of Incos. I'm going to stay with these guys for more 2 years, so I hope to see you in more lives. But my background is basically systems engineering. Came after graduated, and I've been working with that for like 9 years since then, following Incos closely. So I'd like to start alphabetically. So Claudia, feel free to introduce yourself, and welcome Tom, welcome Fabio, welcome Claudia. The live is yours.
Thank you, João. Good evening, Fabio and Tom and João. First thing I want to is to thank for the invitation. Thank João on behalf of Incos Brazil, and I also like to thank the audience who is listening to us tonight. I know that you are taking family time to join us here, so I hope I have something to share, and I would like to listen from you as well. My name is Claudia Tocantins. I'm a system engineer and also I'm project manager. I work at Exuti Foundation for the Brazilian Fundação Exuti in the Defense Projects Department. Well, early in my career, I graduated from computer engineering, and early in my career, I faced very complex projects. I worked with very innovative at the time project on environmental surveillance, And at that time, I'm already working. I was already working with multidisciplinary and diverse teams. And that experience showed me the strength of thinking holistic, thinking the way other people think, trying to understand a bigger problem or more complex problems or something that no one had done before. And I got involved in systems engineer at the time, so I don't call myself a computer engineer anymore, a systems engineer. And I got to start in a certain way in love of the system approach. So that's me. And Exuti, Exuti is a private non-profit organization in Brazil who provides innovative solutions using technology and management for challenges confronted by Brazilian organizations, mainly public organizations. We like to say that we apply system engineering principles to solve complex problems, and we do the conceptions and the design of strategic programs to contribute to the Brazilian development in general, and to improve, of course, the Brazilian agencies and Brazilian government agencies process to do that. So I hope I can share you some of my ideas, my personal ideas, of my experience, my thoughts with you all tonight. And welcome to our INCOS meeting. So the word is yours, Tom.
Thank you, Claudia. I'm Tom McDermott. I'm in Atlanta, Georgia, so I'm calling you from there. I am the INCOSI Director of Strategic Integration. So my role on the board with INCOSI is kind of to look at the strategy across all the different activities that INCOSI has and try and be a bit forward-leaning in that domain. That's an elected position. I'll continue for 3 years. I work with the Systems Engineering Research Center, which is a U.S. government-funded research center in system engineering that's hosted out of Stevens Institute of Technology in Hoboken, New Jersey. But it's actually a network of 22 different universities that all have research programs in system engineering, and so I touch that across a broad domain. In my career, I graduated from Georgia Tech here in Atlanta a long time ago. Spent 18 years with Lockheed. I'm a computer engineer, a computer architect specifically, and I worked for many years as the computer lead and then avionics lead for the F-22 fighter program out of Lockheed. And then I went to Georgia Tech for 15 years and worked in the research center there, doing primarily defense-focused research before I took on this job. I also still teach. I teach at Georgia Tech and at Stevens and other places. I teach systems thinking, and I teach leadership and engineering. And then I do quite a bit of consulting with organizations. I'm actually really interested in enterprise strategy and using systems approaches to help enterprises understand their strategic planning. So that's my background. Again, I'm very, very happy to be here. This is my first opportunity to interact with INCOSI Brazil chapter. And so I really thank you for having me.
Okay, Fábio, feel free to introduce yourself.
Hi, I'm Fábio da Silva, Director of Infrastructure in INCOSI Brazil. Systems engineer by background, graduated from Georgia Tech. And yeah, I'm happy to be here, just helping you out. I'll be helping you managing all the system, and I'm happy to have Tom and Claudia here and everyone watching.
Okay, so thanks everyone again. We're going to start with interesting question here is when we look to the COVID-19 pandemic, the obvious reaction is to think about the healthcare systems. We have a lot of people requiring medical assistance, not just to the COVID, but also for other diseases, and everything is going to get crowded, our hospitals, clinics. But what are other aspects that can be considered on such scenario? How do we zoom out of this healthcare system and stuff, and go to the big picture. So, Don, if you want to start.
Sure, thank you. So I think it's been interesting. I think it's affecting every system that we work in, but you can broadly classify it as being a healthcare crisis. So it's definitely affecting the healthcare system, but it's also an economic crisis. So it's affecting all of our economic systems and our industries associated with it, some worse than others in that space. And it's also a social crisis. So we're all having to change our social behaviors as we go through this process and find new ways of operating in that space. And in the social domain, it's actually quite interesting because we're interacting socially with both the disease and the effects of the economy, but also with the information that we receive in our social domain from the news and other agencies in that domain. And so it's creating cycles of you could call it fear versus cycles of hope versus cycles of normality. And so the interesting thing is there seems to be a lot of feedback between these four major systems going on. And after the early spike, at least in the US, I think we're starting to see that oscillation, where we're going to go through numerous cycles where healthcare wins for a while, and then the disease comes down, and then the economy wins, and the disease starts to creep back up again. And then then the people themselves are going to be more comfortable going out into society versus not, as this thing moves up and down in the domain. And so this is going to be it's going to be a long learning process and be interesting to watch the interaction between all of these systems. Claudia,
You're on mute.
Oh, okay. Now you can hear me. Yeah. What Tom said is interesting. That you were basically saying that we have to watch the health system, but not only the health system, right? That's the main concern on your questions. Most people got confused. Actually, my personal first reaction when I heard that there was a new coronavirus in China, I said, "Oh, I have seen this before," because we heard that from the SARS and all the H1N1, and that didn't arrive here. That didn't concern me that much, since I'm not in the health system. I'm not in a risk situation on my family, direct family risk. That will take a long time, and that's not going to happen. The other thing that we noticed in the media at first, that and that we are lucky because of that, because what we have seen China doing in the first moment, back in December and January, we said that it's impossible to happen here. We don't have the economic strength. We don't have the political organization. We don't have a way of building like campaign hospitals in 10 days or 8 days. And wow, surprise, surprise, that's a new word, as people are saying, because a month later, we had seen that we did all the same things. The disease arrived here. It struggled for we were lucky because we have seen what happened in Asia and Europe, so we were able, our systems and our authorities could plan with a little bit advance, and we have the economic, and we have the society, and we have to manage things that this pandemic is fighting or striking directly two main points for any human being. That's your self-health and also your jobs. So that's a very strong risk, and that takes everybody's attention to our problem. So everybody, I think, will start to learn a little bit on how these systems interact among themselves, and how we are going to find a new balance on this interrelation. I hope soon enough.
Tom, you want to comment something on that?
Yeah. So I would say that my wife works here in Atlanta, but she works for a company that interacts with Chinese factories, and watching the virus spread and then the Chinese economy shut down way back in late January, before we started to realize it here in April, was really interesting. And it was definitely a, oh, that can't happen here kind of attitude that we had back then. But also looking at what they did to come back and how that's persisted over time has been pretty interesting too. So I think we learn a lot from each other, and we also don't learn anything from each other as we go through these processes in the domain. And I think that we pride ourselves on the way we can model spreads of pandemics these days. But I think we also fooled ourselves that the thing would spread through the economy the way it has. And so I don't know that anybody's ever accurately modeled the combined systems of economy and health and social behaviors together, except at a very broad level. And so we're seeing some of those dynamics, and we're seeing, I mean, even if you look back to the Spanish flu in 1918, which had a very similar effect on health and economy, we didn't have the instant communication, and we didn't have the same kind of social dynamic back then that we see here. It's all very localized in the domain. So the social dynamic, as fueled by our information systems, has been quite different in terms of phenomenon in this round.
Okay, Tom, you've said something interesting about how can we saw the crisis starting on other countries. You and Claudia said that, and then we had some time to get ready to deal with that. And you've told something about modeling this crisis. We were not able to model something that could predict what was coming. And Ricardo came with a question. How to weight in complexity when trying to evaluate and model the evolution of the disease itself? Do we even have tools to model a pandemic? Thanks, Ricardo, for the question.
So this is actually really interesting. I mean, I think with this pandemic that we have very good tools to model the spread of pandemics in that space, using agent-based modeling and other tools in there. I think that COVID-19 spread through the population with so many people being asymptomatic, not showing any symptoms, that it completely fooled our models. So our models were kind of assuming that you would see the effects of the disease transmission in most of the population, and we don't even know today. I mean, we don't know how many people are infected and showed no symptoms. It could be a much larger number than we know today in the space. So this is really interesting, because I think if you go back to 1918, we didn't have these fancy computer models, and so we knew less. Now we have these fancy computer models, and we may know more, but they may be telling us exactly the wrong thing. And that's sort of the difficulty with modeling complex systems. It's very difficult to predict where things will go.
Claudia, have you done some modeling, or you're mute again?
Oh, you are controlling, I think, when I'm in mute or not. No, I have not done modeling, but I thought it's interesting what Tom just said, because he said that we might have a lot of models and look into the wrong side of the system. And that goes towards an idea that I personally have, that we spend a lot of time looking at the problems that we face through the magnifying lens of the media, of the press, and that's good. They have a role on finding what's going wrong, especially when we are dealing with public budget, with politicians, with decisions that would affect millions of people, thousands of millions of people. But the beauty of system approach is that we do not need to look at the worst side all the time. So I'd like to share an example that I have the feeling that some systems or some organizations were more prepared, not because they were prepared to this specific pandemic. I just shared before we went online that the other day I attended a risk management training and webinar, and the first question the presenters asked was exactly this: who is brave enough to tell us that you had in your project's risk management plan identified a global pandemic? He tried to prove that there were a lot of signs that they are coming, like winter was coming. But were you prepared for that? And we here in Brazil, we usually feel that we don't have the tools, we don't have the processes to handle that. But that's not exactly true. For instance, just coming back to the healthcare system, here in Brazil, back in the 80s or in the 90s, when the healthcare authorities modeled the unified healthcare system for the Brazilians, what we call SUS, they were already trying to face how to figure out solutions for the huge problems that is bring health and healthcare to the whole country. And I'm not going to tell not about the huge complexity that it is. You can imagine having federal, state, and municipality levels. You have prevention, you have the hospitals, the infrastructure, everything. Brazil is a huge country, has a big economy, but we are underdevelopment country yet. So let's take only like São Paulo, the city where I live right now. We are like the fourth largest city or metropolis in the world. The integrated health system here has to handle like 30 million inhabitants. They, by law, by our constitution, the government in all these different levels have to provide health care for this population. So how do you see it using systems approach? Exulting in the past, in, I think 2004, were partner with the city of São Paulo health secretary, and we helped them to elaborate and to build the first conception, to design the first conception, how they will automatize, they will build software systems to handle this challenge. And when we first look at this, we noticed that for tackling 22 million users, like that was like 70,000 daily appointments that they had to manage every day, and they didn't know. And we were like in a very packed but large city. So if you are not happy with the doctor that you visit, or you cannot have an appointment in this first care, basic, the entry point of the health system, you just cross the avenue and go to the next neighbor, right? So we tackled this system with them, trying to entering by the appointment management, trying to find out who was inside the system to gather data. The system informatization, which is still running today, was based on the National Health Register, and it. I believe that with what made São Paulo city today, we are struggling with the pandemic, but we didn't see in the news the same kind of news that we heard on what happened in Italy, for instance, or in Spain, where there was no hospitals. And going back to the question I made before is, yes, Brazil was able to build not one, but several dozens of field hospitals before being hit, before arriving to 100% of occupancy in the hospital. So I believe that was because we had a previous system approach to handle the problem.
Okay, then getting what you said about, you both said about modeling and trying to act before something happens, okay, in terms, even modeling or risk management. There's a question from Antonio Pedro. He's saying that in this pandemic scenario, enterprises are awakening for crisis management, as Claudia said, and the need of business continuity plans that requires quite a lot of system vision. Could you comment on that, Claudia and Tom? Feel free to talk about it.
You want to start this one, Claudia?
I can. Actually, yes. I mean, we are talking about crisis management, which is a completely different, a separated discipline, field of studies. But I do believe that both crisis management and system thinking has a similar background on this holistic view, as João said before, zooming out from our first short-term concerns to make sure that we will be able to reach better decisions, right? So again, taking what we have done in Ezuti this year as an example, back in March when actually the pandemic arrived and started locking down and the diseases started to spread here, our first and immediate concern is on ourselves. So the first action we take was to build a mitigation plan. The HR people did that to make sure that they will know how to handle if some of our employees or their families were hit by the disease. But we started also to brainstorm ideas on how to support customers. And when the first challenge that we imagined that our customers and clients and partners were having would be something on how the state and local governments were organizing themselves to offer or to handle, to tackle, to have these, what we, as we said before, holistic, multidisciplinary view. And we did actions on that. And in the third level, and I can go further and talk about what we did to support in the first weeks of the pandemic. And now we are in a second stage or a third stage where we are reviewing the business impact, not only for our business, but for our customers' business. How, what kind of data that we have to make sure that we can draw and design better models the next time. How is the world changing? And that's another topic I want to go further later on. And how can we support the organizations and the business to be prepared to this new world with this newer knowledge, how to find a newer balance on the systems environment. So that's it.
So those are good points. So Fabio would remember that at Georgia Tech, we teach systems engineering and systems thinking through case studies on crises, because the adaptability that you have to show in a crisis management situation it's a perfect example of system engineering your way through a complex problem in the space. And so I think crisis management view is a perfect way to look at it. And I think business continuity is the lesson that we learn after we've been through crisis, so that we're more prepared in the future in the domain. I'd say it's been interesting to watch different businesses. I'll say that our organization here in COSI, which is composed of a bunch of leadership who are all system engineers, worked through its business continuity really without a hitch. It was a lot of work, but we had to do a lot of things like go to a virtual conference this summer, as well as many other things as this crisis had set in. And it was all just sort of a natural way of doing business for your family of system engineers that runs in COSI, because we're used to thinking like that in the domain. I can tell you that the universities I'm associated with did horrible in general for continuity, business continuity. I mean, they were generally unprepared, but they're not necessarily systems thinkers in those domains. And so I think organizations that have to deal with this stuff, large businesses do pretty well. The really sad thing is all of the small businesses that, don't even know what business continuity means in a lot of spaces. And so there's a lot of tools out there. There's a lot of simple guides to business continuity planning and risk management and checklists that small businesses can follow. I think it's a really good opportunity for people to learn that, take it seriously, and we're going to see more waves of this. So make sure that we're prepared for the next round.
May I get the word back to me before we change subject? Yeah, before I would like to explore a little bit more on the crisis management ID subject, and go a little bit further on what we have done in the I'm calling here the second moment. So first moment, trying to find a way of surviving. And that's pretty much and I'm lucky, and I want to tell everybody else that I work in a high-tech company in a very technological problem. As Tom said, most of our economy was very hard on the needed lockdown, because service, commerce, informal labor, it's the base of the economy here in Brazil, and most, I think, countries as well. But on the on the crisis management, we thought that before actually being able to know if we are going to work or not, if we're going to lock down or not, which level of locking down, we needed leadership, and we needed leadership from the authorities, the government authorities. And so back in the first week or second week of March, when the pandemic arrived in São Paulo, we figure out how can we share, as Tom said before, we think about, João said, we think about helping to build hospitals or help to build, but we do not have this expertise. What is our expertise? So we end up, we brainstorming some ideas, and we end up offering a free or a pro bono lecture to train the Brazilian state officers on how to implement their crisis offices. How could they actually organize themselves before it was too late for them to react and to help remembering that we have like 27 different states here in Brazil with different levels of problems, with different levels of budgets, and also people. So we brought an old partner, old-time partner that we have, the Professor Claudio Sena, who is also a former Navy officer. He's an expert on crisis management, and actually he wrote a book You can find on Amazon. I believe that he might be listening to us, right? So he can add on the chat the link to his. But we brought together like 27 representatives from 7 or 9 states, local authorities, to share these processes and to share this knowledge on how to handle crisis. And the basics for crisis management in Siena's point of view is to use Cartesian thinking, joint military operation planning, design thinking tools to understand the cause and effect, not to lose the short, medium, and long-term view of the problem, not to make decisions based on the first needed and not being able to recover the commerce and the economy. So how to divide this complex problem in smart time. So I believe that if you want to read a little bit more on how we found it, I recommend Siena's book, which uses like a very interesting, what it calls critical map canvas to do that. And I believe, and what I'm seeing as a citizen nowadays, that a lot of, or several of the authorities are handling this coming back process in a very careful way. So only yesterday, São Paulo State published their education system recovery plan. And what they are saying is that it's not going to make anyone happy, but they have to tackle a very complex situation, a very abnormal situation in a safe way, because people don't want to lose lives when we are coming back, and they want to go back to work as soon as possible.
Claudia, I'll just put up a question here that's exactly about what we're talking. When you go to crisis management and business continuity, we're talking about companies, but we could also talk about lives itself. We talk about people. So, Hauni came with a question that's gonna kind of change our direction here about job and career crisis. What are your views about it? Do you feel that's an opportunity to move across different industries than the one of your background? Is it not just a business continuity for companies, but also for people? How do you think about it? Tom, Claudia, feel free.
Start if you want. Yeah, so I think one of the things that we'll be doing in the next months, and I know in Cozy, our organization here is going to actually do a session on this we call Life After COVID-19. So we've been through this phase of we're changing permanently in how we do things in our businesses, and we're probably going to be doing a lot of reflection this summer on what was good about it and what was bad about it. And we'll be doing, a study of how we should operate in the future, not just when the virus continues to scale up and down over the next year or so before it dies out, but also permanently in terms of how well our business operated in a much more virtual environment. So I think that that's the same thing that we can do personally, is take a look at how we adjusted our lives in this domain, what we did good and what we did bad. And then, if it feels like we need to make a move to a different career, then find something that hits the sweet spot in what you learned about yourself in the process in that domain. That is kind of the systems approach, is to model what you were doing and then build a model of the things that you did now as you went through this, and then build a model of the things that you think are good for you in the future and make your decisions around that. So it's a great opportunity. Now, on the flip side of that, I wouldn't quit my job if I had one right now, because it's going to be a lot of turbulence in the labor markets for the next little while. So it's the key point there is it's a good time as we're coming out of all our lockdowns to reflect on what was good and bad and use that to drive our future. Claudia?
Yeah, I love it what I heard on saying, because that's what system thinkers do. They do not avoid difficult questions. My first thought was, well, I'm not a coach, I'm not an HR consulting or anything like that. But yes, I can understand your question. Raoni, I think. No? There are long-term consequences, not only on the society or in the government or in organizations, also with people. And one interesting thing is that changes were already happening. That's what I am hearing the last few months, but not only 2020. Before that, like 2-3 years ago. Might be because of the climate crisis that it's getting people's attention. I don't think that it's a new problem. I studied environmental issues from the 90s, early 90s. It might be what the marketing and the organizations are calling the digital transformation. Actually, if we see in Cose's cousin PMI, I call it cousin because I'm involved in both sides of my two careers, and they are calling the project economy, who are going the project managers who are going to make sure that we are managing changes that are happening. Well, it's not coming anymore. The pandemic accelerated it very fast. So as I said, not everybody has the same situation, and we have to trash the how to do book this year. Everything that we are planning for our careers or our career change, move, may be changing now. If you lost your job, you need to go through another thing. So the idea, normally change management, you think on planning, you experiment, you evaluate, assess, and then improve, and you do that in a cycle. Well, you have very agile, to use another term that people like to put on in the curriculum, and that's what I see, for instance, in the education system. They changed it from zero. I saw teachers, like children's basic education teachers, who didn't even had a computer at home, and 2 weeks later, in March, some in April, and nowadays, I'm pretty sure that 100% of people who are working with education, all the levels, are working from home remotely and using the tools, learning in a different way. So change your career path, take the opportunity. Everybody is offering webinars, everybody are offering free or very cheap education. Do a lot of networking, join Co's chapter, be a volunteer, and try to experiment, and try not to do that because of the crisis, but also because you are planning to do that. Study the problem and build your project over how you want to tackle your personal situation as well.
I'd like to add a comment about the way we work too, which has been kind of interesting. So based on your thoughts there, Claudia, I mean, I've been teaching online in universities for 12 years now in a completely online format. And so it was absolutely no change for me to adjust to the new format that education system had to go into. But I know so many professors and universities that had never done it before, and they had no skills in that space. But I think they're mostly comfortable with it now. I was really reading a really interesting exchange on LinkedIn in the model-based system engineering domain, with some people talking about how, even though model-based system engineering has been growing in their organization for several years now, the forced virtual environment forced everybody to go work out of the models now instead of copying pictures onto PowerPoint. So while they said they lost a lot in terms of the face-to-face brainstorming around problem solving when they needed to have it, for the routine work, they found that being at home and being virtual is actually much better than being in the office where you're interrupted constantly with people. You're working in a native format now. So I think this is a big shift. I mean, there are going to be some long-term permanent changes out of this, and we all think about how that'll affect our careers in the future.
Yeah, I think chemistry had a word for that. What we would use to accelerate the reactions. So every crisis, and the history showed it from the beginning of human society, I believe. Every crisis, and we are a lucky generation comparing with our grandparents, that we didn't face global world wars, and we never thought that we would have to handle. So I'm curious on how the next generation are going to look back to us and ask themselves what happened in 2020 that accelerated the transformation of the world. And people are also not only on the technology or the business point of view, the economic point of view, but also on the social and value point of view. What is important is to accumulate money and richness, or is actually being concerned on the global challenges. As I said before, there is a huge concern for at least 20 to 30 years on the climate change field, that might be one thing to think about on how we are going to handle that. My son had a school assignment in the first month asking what has changed in our way of buying stuff. And we struggled with answering that because my family is not very consumption. We do not spend money without thinking about that. So in the first week, we didn't buy anything, or in the first month, we were not buying anything. And I said, well, nothing is going to change. But if I look at my bank account today, I say that every time I went outside my apartment or my home to do anything, I spend money, because I'm saving money right now only because I'm at home. So I probably didn't need all these new shoes and books and everything else that we are buying, which were important for the economy to work the way it is, right? So
okay. Well, we're talking a lot about change and how resilient we have to be, how we're changing our lives, our routines. And Ricardo came with a question that may drive us to the future of the discussion: is how should nations size their health systems for pandemic preparedness? People tend to accept a fleet of F-22s for a potential military threat, but 100 of ICU's beds are seem like a waste of money. So how can we prioritize investments and kind of stuff? Claudia, if you want to start.
Well, Ricardo, I think that that's how poor countries, and I don't think Brazil is a poor country, but it's I know that in a personal financing point of view, we do not have money to do everything we would like to do, and we don't have money and we don't have budgets for everything. I don't know. We have to go through the system approach probably to understand what are the impacts on investment and how to be able to distribute our budgets in different fields, in different areas. So yes, we do have an obligation as a society, and in my opinion, and also by Brazilian Constitution, to provide health, to provide employment, to provide education to everybody. So how can we handle that? How can we manage that? That's why we have to educate our population, educate our people, and maybe system approach, which is not used. We are mostly in code here in Brazil, in the code chapter event that I was, are engineering. Your example comes from the aero industry, but we can use the same tools to social fields to understand how we are going to model the complexity of the society itself and how to improve our process. That's what we are trying to do as citizens and, for instance, Ezuti as an organization, how to help the decision makers to do better decisions, to make better decisions. Have anything to add on that, Tom?
I do. I love that question, Ricardo. I think it hits at the heart of system engineering. So one of the things that we learn in system engineering, distinct from other disciplines, is the concept of first order models or sizing models. And one of the things I find with engineers is that although they know how to do great design of second and third order things, if you ask them to build a sizing model for that, they're lost. I mean, they could never tell you how many of those things they may need to build or people might want to buy in that space. And so this is a really good example of where systems engineers can help. I know a lot of my system engineering friends, they've got spreadsheets and they're tracking their own COVID-19 data and they're doing their own sizing models for fun, and so they could tell you how many ICUs and hospital beds that we're going to need in Atlanta probably this fall as the disease starts to grow up again. I'm not sure that actually anybody in the hospitals could tell you that because they don't necessarily have those system level skills. But I think this is a space where system engineering can really help in that space. It's a very difficult problem because it is complex. I mean, our models are going to be not that accurate based on how the virus has presented itself, but you can track the ebbs and flows of cases and hospitalizations and things like that with public data today. It's all out there, and you can build your own models pretty easily to size where things have been and where they're growing to and what they might go to in your region without much problem in that space. So I actually probably think that we have enough data out of the first rounds of this to be pretty predictive on where it might go in terms of sizing in the future. We just need to train more people to think like that and be prepared. That's my opinion anyway.
Okay, awesome. Claudia,
No, I was only going to add that I agree with Tom with the data gathering point of view, that we have technology, and one of the aspects of the digital transformation I mentioned before is exactly that. So data science is another field that is being very well developed, and it is getting faster advancements right now. So yes, I also know a lot of people who are actually writing their own models, and they are building their own spreadsheets and data graphs and using all sorts of skills that they have. So how can we integrate all these things and build knowledge and new knowledges to improve our reaction the next time? And I'm also listening people saying that we are not going to be this pandemic is not going to be over, that the what they are calling the new normal would be several new cycles of global problems that needed local solutions. But we will always, that's the zoom in, zoom out perspective that we bring on the system engineering. So I think people who have system engineering training and change management training will be able to add a lot about that with that.
Okay, great. Again, going to a next topic that's really related to what we're talking. is we've been talking about different ways to manage stuff, and now we're talking about a system approach to manage. So how can we manage the future itself? How can we get ready for our next crisis? We may have more of COVID and other crises coming. How we're gonna deal with that? With a system approach, of course. Tom, if you want to start this one.
Yeah, I think personally, I think the complexity thinkers would be more prepared to answer that question than the systems engineering people in that space. We like nice stable designs in system engineering. So I think you know, one of the things that we've learned is don't necessarily trust the models in that space. And I think another thing that we're learning is that the interconnectedness of society and economics and health these days, with health being such a big business, is driving the world in a way it hasn't in the past in this domain, in that space. And so I think that you know, we can learn a lot of lessons out of this, and we can hone our understanding as a situation as the virus evolves over the upcoming years. You know, some people will say with data that the mortality rate of this virus hasn't been any more than usually happens with the seasonal flu. Some people will say, no, it's been much higher in that space, but we don't actually know because we don't know how many people actually caught the virus these days. We could be grossly underestimating that in the space. I think we know that this is a lot more people are getting it than normally hit seasonal flu. So, you know, I think we'll be looking back and trying to wonder if we actually overreacted, if we underreacted, if we came back too soon, if we didn't ease fast enough for the economy in that space. And so I think there's a whole lot of learning left to do. The thing that systems thinking teaches us, and I'm just a big core believer of this, is that you've got to allow yourself cycles of learning. You've got to allow yourself the ebbs and flows of learning over time in order to build a better strategy in the future. And so I don't have the answer. I don't know how to predict what we should do next. I think we should just be collecting the data, modeling it, and learning as we go along, and then trying to improve with every round.
I like the concept that Tom said about the cycles of learning, because I do believe that some people say that history repeats itself. I disagree. I believe that we evolve in a spiral way. So we face again similar challenges, but in a different way. So I don't believe that we would be able to lock down a city like New York or São Paulo. São Paulo, not for sure, like 10 years ago. We wouldn't be able to bring your work environment to home. You wouldn't be able to start learning who is your global provider or your local commerce to be able to help people because we didn't have this connection on the social media and all this information. So yes, we are gathering data, and data is dangerous because you can interpret data on the direction that whoever is reading it tries to. The beauty of our new world, of our of nowadays, is that we can check. That's the principle of the scientific process. Whoever wants to analyze the data will be able to rebuild a scenario, simulate different scenarios, and propose different solutions. But they are going to be challenged by at least another 20 million experts on whatever you believe that you are selling the world. So I think we are going ahead. We are improving. We are going to go back to almost normal life, but that's a different normal life than we had before, the same way that we have now a normal different from 5 years ago, 10 years ago, 15 years ago. So I guess João needs the word because we have finished our time. Is that right?
Yeah, we're going through 1 hour of live, so do you guys have time for just one more question? And please, you guys that are watching, stay there for like just 2 or 3 minutes. Can we go for next question?
I can.
So, okay, Claudia. So that's an interesting question that came from Jose. He's asking, isn't it a problem to be managed in smaller settings instead of from nation centralized solution? How do you think about that? That has been a question that came from many states in Brazil mainly. So how can you manage that smaller or central nation?
I do believe on that quote that says that we have global problems and local solutions. So undoubtedly, that's one of very obvious example of a global challenge, a global problem. But each localization, each person, each company has its own perspective, its own bias on how this problem is affecting you and your environment and the people around you. This particular pandemic is hitting very hard because, as I said in the beginning, it deals directly with lives. So right now, I believe most people I know someone who got the disease in a certain way. So it's not easy to say that it's okay to survive to this period. But we are going to be able to adapt and to find the new balance on the systems locally. But there is no way of taking it apart. We have to go on both levels, in my opinion. Did I say it right, Tom?
Well, viruses spread by human contact, so it's a local phenomenon, at least at the start, and hotspots happen locally. The big question I think we're dealing with, this is particularly true in the USA, is how much of it should be managed locally versus how much guidance should you set at a state or national level in that domain, which is more policy guidance. And one of the things we've seen, even looking at broadly and globally, like with the World Health Organization, Center for Disease Control, is that there's been struggle to have consistent global guidance and policy around this in the space. But I think in the end, what we're going to see with hotspots of the virus, it's going to be local hotspots, and it's going to be very much contextual with the spot where the virus is spreading rapidly in the space, based on local conditions. And so the big thing you can't do is have like broad national guidance and policy without any local governance, because local governance is going to have to actually do all the work.
Okay. So just provide the feedback. There is someone asking for 30 more minutes, but we're not gonna attend you, Adrian. Sorry for that. We have to have topics for our next event, so that's why I'm not keeping here for 30 more minutes. But we're coming to an end, so I'd like to thank you guys again, Claudia, Tom, Fabio. It was a pleasure to be here and coordinate this kind of discussion, learning a lot, of course. Thank you guys that were watching this live view, and the guys that are gonna watch. It's gonna be available on YouTube, Brazilian channel as well, so you can see later. I'd like to invite you guys to fulfill our feedback form. It's going to provide for system engineering professionals 1 PDU, and also we're going to provide us useful information for our next event. So we're trying to make things better and better, and it's important to get your feedback. Thank you again, everybody. We invite you again to follow us on our social media, Instagram, Facebook, LinkedIn. We have a lot of good content to share and good people to talk with. So increase your network, join us on our social media. And thank you guys again for our time, for our attention, and for our knowledge, most of it.
And all you people sign up to attend in Cozy IS Virtual in July.
Yeah. Okay.
I will.
Fabio's you can see him.
So are we saying goodbyes? Thank you, Tom, for the insights and for the nice conversation. It was a pleasure to meet you all guys here. Thank you, Incos, for the invitation again. Thank you for all the volunteers from Incos who are in backstages making that happen. And I also want to say that you should be getting involved with your professional association, Incos being one of them, if you are a system engineer. Doing volunteer and having a global network is very, very nice for your career and for a personal improvement. So nice again. Thank you again for being giving us the opportunity to say. And you can find me on the social medias. I believe you can find in Cozy as well.
Oh, by the way, we were not able to answer all the questions, but we're gonna send them to you guys, Tom and Claudia, with the names of the one who asked. So you guys feel free to get in touch and answer the questions. Okay.
It's putting a lot of pressure on us.
Yeah, I would like to thank you guys. It was a lot of work to organize this, and was very nice. And thanks, Tom. Thanks, Claudia, for your words.
Thank you very much for having us.
Thank you, everybody. See you on our next event.
Good night. Bye.
Good night. Bye-bye.
Bye.